Hello, med geniuses. Welcome to another anatomy lecture series on the Popliteal Fossa. It is a great science tutor, Lorenzo, and if you are new to this channel, please make sure to subscribe. Don't forget subscribe, and again turn on your post notification button so that anytime I send any video or I upload any video, you'll be sure to see it. And like I usually say, if you have any questions or any reactions, or you want me to make any video from you, make sure to also comment on the comment section. Today, don't forget to be doing the Popliteal Fossa, and one thing about the Popliteal Fossa is a very important space. I'll be using the following outlines. And what are the following outlines? The normal introduction, the boundaries to the Popliteal Fossa, the content of the Popliteal Fossa, and the clinical correlation of the Popliteal Fossa. Introduction, boundaries, content, and a clinical correlation of the Popliteal Fossa. Now let us dive into the video. In the introduction to the Popliteal Fossa, we ask the question, what is the Popliteal Fossa? The Popliteal Fossa is a diamond-shaped hollow depression. A diamond-shaped hollow depression located at the back of the knee joint. It's a diamond-shaped hollow depression located at the back of the knee joint, and it is more prominent when the knee is flexed, because when the knee is flexed, the muscles are relaxed and more apparent. From there you can envision and you can see the Popliteal Fossa very well. The Popliteal Fossa, like every other space, transmit neurovascular structure from the thigh to the leg, from the thigh to the leg. So the next part is the boundaries to the Popliteal Fossa. Now, what are the boundaries to the Popliteal Fossa? Just like every other space, the boundaries to the Popliteal Fossa at the superior-lateral side is the biceps femoris. The biceps femoris borders the Popliteal Fossa at the superior-lateral side. The superior-medial side is two basic muscles, which is the superior tendinous and the superior membranous. So, because the biceps femoris, the superior tendinous and the superior membranous, they are what they are called hamstring muscle that borders the Popliteal Fossa at the superior region, while the inferior region at the medial side is the medial head of the gastrocnemius, while at the lateral side the lateral head of the gastrocnemius. So hope you got that. Now, at the roof of the Popliteal Fossa, the Popliteal Fossa at the roof is your skin, superficial fascia, popliteal fascia, and also cutaneous nerve and vessel. The cutaneous nerve and vessel are the short saphenous vein, and the cutaneous nerve includes the sural communicating nerve, the terminal branch of the posterior cutaneous nerve of the thigh, and the posterior division of the medial cutaneous nerve. All pierces through the popliteal fascia, except from the posterior division of the medial cutaneous nerve of the thigh. All these things are located in the roof. The roof of the posterior surface, and also the floor or the anterior surface is related with the popliteal surface of the femur, the capsule of the knee joint, the oblique popliteal ligament, and last but not the least, the popliteal fascia covering the popliteus muscle. Very easy, very simple. So when you know all these boundaries, it is very easy to articulate and to know what the boundaries of the Popliteal Fossa is. Now, the content of the Popliteal Fossa includes a nerve, an artery, and a vein, and a lymph node. Don't forget, every content of every space includes a nerve, an artery, a vein, and a lymph nodes. Don't forget that. So if you want to talk about the nerve, what is the nerve that is passing? What is the nerve that is transversing through this place? Because the sciatic nerve at the top part of the Popliteal Fossa divides into tibia and fibula, or tibia and common peroneal nerve, tibia nerve and common peroneal nerve, or you can call it the fibular nerve, but it's usually called the common peroneal nerve. That is the nerve. The artery is the popliteal artery. The artery is the popliteal artery, because the femoral artery at the adductor hiatus becomes the popliteal artery at the Popliteal Fossa. The vein, the popliteal vein, the same thing that occurs with the popliteal artery. So one thing you need to understand here, since we have the NAV, now we have the lymph nodes, we have the popliteal lymph nodes, we have the popliteal lymph node, we also have the popliteal part of fat. We also have the popliteal part of fat, and we also have other structures here, which include the terminal branch of the posterior cutaneous nerve of the thigh, the terminal branch of the posterior cutaneous nerve of the thigh. We also have the geniculate branch, which is a branch of the obturator nerve. Don't forget, and you also have the short saphenous vein. These are content of the Popliteal Fossa. Don't forget that. Now, how does this relate clinically now? How does it relate clinically? Now, we have what's called the popliteal pulse. You can still feel your pulse, which is the movement of blood through your popliteal artery at the popliteal fossa. We call it the what? The popliteal pulse, but it's usually difficult to determine because it's not unlike the femoral pulse or the brachial pulse. It's not like the same or the radii pulse. The popliteal pulse is usually felt when the knee is flexed, when the popliteal fossa is more prominent. It's felt there. So, but it's usually the most difficult to what to calculate or to predict. The next one is the popliteal aneurysm. The popliteal fossa is usually the popliteal artery rather is usually more prone to aneurysm. Are you getting me? It's more prone to aneurysm even clinically. So, and we discussed it in the adductor canal that when you want to ligate the popliteal aneurysm, it's usually good to ligate and cut it at it's usually good to ligate and clip it at the adductor's canal to make it easier. So now, since with this clinical correlation, hope it all made sense. Hope it all made sense and you understand what the popliteal fossa with all the mnemonics I gave you. So please, if you are new to the channel, please make sure to like, subscribe and comment. If you have issues or any part you don't understand, make sure you comment it on the comment section. When I go through it, I'll explain more to you, or I make a video to correct or to add anything. So see you in the next class. Goodbye.